Snoring, insomnia, waking up exhausted. How do you know when it's more than just tired and it's time to get some help?
Welcome to What Brings You In Today, a podcast from SGMC Health.
I'm Cara Hope Rockwell.
And I'm Erica Bennett. And today we are here with Dr. Eisa and Shelby McNeal, who's a nurse practitioner, with our neurology and sleep medicine services. So, team, what brings you in today?
So we are so excited to come this morning and introduce y'all to some things we treat at our office and sleep issues and neurological issues that we treat at SGMC Neurology and just give some education to give to patients.
Yeah, we're very excited about this particular episode because sleep is something that impacts every person, right? We all have to sleep, and we don't often know when we need to seek additional help. So we're excited to learn about that. I do want to take a few moments first to just, if you'll each give your background and kind of what landed you here, and then we'll get into this.
I have a very long history of my medical career,
Okay.
Initially starting with the family practice and going into ophthalmology. I was board-certified ophthalmologist in Kenya before I moved to America. And then I did neuro-ophthalmology, neurology, sleep medicine, and, that's the gist of it.
So what made you switch from the ophthalmology, though?
Yeah.
That's interesting.
When I came here, I found that neuro-ophthalmology will be a very interesting field to go into. Yeah. And frankly speaking, ophthalmology was one of the most difficult fields to get in at that time, when being a foreign medical graduate, despite the advantage. So I was at Yale. I was the director of the Movement Disorder Center, but I had a very good offer down south, joining Dr. Patel and group, and I had two young daughters going into expensive schools.
Yeah.
So I had to make some more money.
Yeah.
That's the gist of it. So I landed up here, which is
driver.
really good because I really enjoy that. And I'm still in academics. I'm a professor with the Medical College of Georgia, also professor with Mercer University. And I'm leading the sleep clinic and the neurology department as well.
Very good. Yeah. All right. Shelby, what about you?
And then for me, my nursing background started in ICU. So I was an ICU nurse before I became a nurse practitioner. And then I did family practice urgent care for a short bit before I landed in neurology. So I've been with Dr. Eisa for 5 years this year. And it's just truly been one of the most rewarding careers that I could have ever asked for. Just treating our patients and the things we get to see every day is such a joy. And working under Dr. Eisa is just a blessing, really.
So speaking of patients, what type of patients do y'all see? Give us a little insight into that.
Being a consultancy practice, we get referrals from family practice and all of the specialties as well. Yeah. So we see all sorts of neurological disorders as well as sleep problems currently. Yeah. And patients who are difficult to treat through primary care, they have difficulties treating them. They send them to us and we see them.
So we see everything from seizures to migraines to Parkinson's disease, even more complex issues. Of course, a lot of sleep issues like restless leg and obstructive sleep apnea, insomnia, parasomnia, narcolepsy. We treat a lot of different things.
Yeah.
Neurology is really actually a big, wide, complex.
Yes. Yeah. There are a lot of neurological problems associated with simple medical problems, for example, diabetes. There's a lot of neuropathies and other associations as well. A lot of strokes from high blood pressure, uncontrolled diabetes. So that ends up with a stroke and, sort of jack of all trades, put it that way.
You kind of have to be, right?
Yeah, you have to be.
All right, well, let's talk about sleep specifically. Let's kind of get into that, and then we can go into, I think we'd also like to talk about dementia and some of those things some newer things that we're offering. But sleep. When should someone seek a specialty consultation when they're having issues sleeping?
So I'd say one of my biggest recommendations is, I think a common misconception is being tired is normal. If you are tired every day, even if you sleep great, that's not normal. If you're falling asleep while watching your favorite TV show or eating or, especially if you're driving, that's dangerous. So that's not normal. So if you're having red flags like that, loud snoring, if your partner's like, you're keeping me up all night long, I cannot sleep, that's not normal. If you're waking up gasping for air or choking, those are things that we can treat and dig into more. So those are things that if we can educate patients in our community to be seen for, we can help diagnose it quicker and treat it quicker.
How accurate are those sleep scores that you can get from your watches? Because I know Cara Hope and I both,
Yes.
and I get like mad if mine gets low, and I'm like blaming people for interrupting me and messing up my sleep score.
Yeah.
There's a lot of these devices which have come out and they use artificial intelligence to score them. And right now the FDA has not validated most of them except a few.
Okay.
One of them is, the Apple Watch. Yeah. And there may be a few
Yeah.
others. But the problem with that is they're based upon movement and they're based upon your cardioballistic. It gets a little bit complicated.
Yeah.
But basically, it doesn't tell you that you may be quiet and lying down and not asleep.
Right.
They may record that as sleep. Or you may be having movement disorders in sleep and moving, and that may record that as awake, but you're asleep.
Okay.
So, I mean, that's sort of a screening way of saying that, you may be having sleep problems, but that's not a very accurate way of doing that.
Yeah.
Yeah.
I do think it's a good, just to raise awareness
Exactly.
of like, and maybe like getting to bed on time and like doing things that you can do to kind of help
Yes,
with your
that's a
sleep.
good
But that
aid
is
to that, yeah.
interesting that you say that about, because I did wonder like, how can it really tell if
Yeah.
I'm asleep?
Mine says
Yeah.
97 very high from last night.
Well, I'll have to figure out what mine is later. But I don't think it was that because I was sleeping on the couch because my husband has a stomach virus, so we weren't doing that.
I mean, it is a useful tool telling you that something's going wrong. Go ahead and get some further consultation or assessment done.
So what kind of assessments do you do when someone comes to see you for?
So first is, to me, it's looking at the whole picture, right? Because someone might come in and say, I'm tired and treat this, or I'm not sleeping through the night, give me medicine for it. We got to look past that. To me, it's finding the culprit, right? So if we treat just the symptom, we might be missing the bigger picture. So, we first start with a good history and physical, even looking at a patient's mouth. I can kind of lead to some further testing for that. And we have our sleep lab that Dr. Eisa is the director of. So we have actually something here at SGMC that we can do home studies or in lab studies to test patients for sleep disorders. And so really digging into their symptoms and what they're presenting with so we can see what the next steps of diagnosing or evaluating them for.
There are many different problems with sleep. One of the commonest problems is poor health hygiene for sleep. Yeah, a lot of people are on their tablets, on the TV screens, playing games late into the night. Their habits are wrong. They drink alcohol at night. They have smokes, or they take caffeine too late at night. All these will affect the sleep. Yeah. So sleep hygiene is very important, and if people don't follow that, they will have sleep problems. In reality, that's not a sleep problem from the pathological point of view. It's behavioral. So if you can improve the behavior of people, educate them more on what is normal sleep, natural sleep, that will cure a lot of perceived sleep problems.
What are the recommendations for good sleep hygiene and how long you should be sleeping?
Well, God made the night for sleep and day for wakefulness. That's number one. Yeah. So at night you're supposed to sleep. So you shouldn't be doing daytime activities like Las Vegas. So bright lights, blue lights wake the brain up. Stimulation wakes the brain up. So what you need to do to get good sleep is have relaxation, exercises, meditation, whatever, a nice warm shower, and then relaxing things to do like reading a book in yellow light, not in blue light. Because yellow light does not wake the brain up as much as blue light in your face does. Yeah. And then your relaxation and go to bed at a set time. So discipline is extremely important. So you got to have a set time to sleep, a set time to wake up.
Because you can't make up sleep, right? You can't like catch up on your sleep.
I'll give you an example. One day of loss of sleep, let's say you only slept 3 hours, will take 2 to 3 days of catch-up sleep.
Yeah.
And then if you do it on a persistent basis, you never catch up.
And how important is sleep, like for your body?
It's extremely important because if you don't sleep, your brain doesn't rest, and the brain controls everything. So when you sleep, your body regenerates, invigorates. It takes out the trash, for example. It calms down the body.
I like that.
Yeah.
The trash.
If you see Inside Out, the
Inside Out.
Inside Out, the Pixar
Yeah.
movie, the Walt Disney movie, that puts it in perspective. That's what
Yeah.
exactly happens, you know.
I love
Yeah.
that movie.
So the next day when you wake up, you're fresh. Because the brain controls everything. If it's not resting, you're stimulating the heart. You're putting stress hormones onto the rest of your organs. So your diabetes, high blood pressure, mood disorders, and everything else gets worse. So you got to have your restful, peaceful, invigorating, restful sleep.
And I always tell my kids, I'm like, you have to sleep because that's when you grow. I mean,
Oh,
for
yes,
them,
exactly.
like, I'm like, your body can't grow unless you are asleep. And they're boys, they want to be big, you know. So I'm like, go sleep. It's
Yep.
okay.
Yep.
It's
Yes,
sleep.
yes, yes.
Yes.
And is the recommendation 8 hours?
Well, take this with a bit of pinch of salt. The recommended time of sleep is 7 to 8 hours. So that's one of the misconceptions that everybody must have 7 to 8. But there's a small proportion of people, for them normal sleep is only 4 hours. They call them
Wow.
short sleepers. And there's another proportion of people who are long sleepers.
That's me.
And they need at
10,
least
12
10
hours, yeah.
to 12 hours of sleep. And that's normal for them. Yeah. But the majority of population require between 7 to 8 hours of sleep.
Interesting.
And as you get older, you require less hours of sleep because it is broken. As you get older, the sleep is broken up. The sleep is not as deep. And you can allow to take a nap after lunchtime. That's normal.
Yeah.
So you can take your siestas after that.
I
And
like
that's,
that.
Yeah, that's restorative.
Is there an adverse amount? Like, would sleeping too much be a symptom of, like, if you find yourself where you're like, I'm sleeping this excessive amount of time?
Yeah, statistics show that people who sleep too much, not long sleepers, spend too much time in bed, have a higher mortality rate than people who are more sleep deprived and have less hours of sleep. Yes, so getting the adequate hours of sleep is important.
So that's why I tell patients, if you are waking up and going right back to sleep, that's not normal, right? So if you're having to sleep really great and you feel like you woke up and you had adequate 8 hours, then an hour later you're getting back in bed and sleeping 2 hours, that's, that's too much.
Okay. All right. So what are some things you can do to help your sleep? If you go and you get diagnosed, what are some things that y'all offer?
Well, the initial thing is just finding out what's the cause of the problem. So that's just simple talking interview. Yeah. There might be other things which may be going on. For example, people with restless leg syndrome. One of the commonest causes is iron deficiency. So a lot of women have that because they never catch up on their losses from various causes. One of the simplest treatment is just to treat the cause of the problem. If it is behavioral problems, take away the lights, take away the blue lights, have some discipline. So there is what you call sleep hygiene, things what not to do and things what to do to improve sleep. This is easily available everywhere on the internet and all that, as long as you go to a validated site and not some influencer. Yeah. So if you do that, you go to,
Are there sleep influencers? Because I could be that.
Oh yeah, there are a lot of YouTube videos. Put a tape on your face and all that. Yeah. So that's like snake oil, selling snake oil.
And I don't like the thought of something being taped over my mouth while I'm sleeping.
But you go to places like the Mayo Clinic or Harvard University or the American Academy of Sleep Medicine or something which is validated, the NIH or that, and they'll give you the proper information rather than going to, how many hits did this video have?
Yeah.
So that's not the right
Let's
one.
talk a little bit about sleep studies. So
Yes.
I think some people might be a little bit intimidated by that, and what's the difference in a home sleep study versus one that you get at SGMC Health in the sleep lab?
The different levels of sleep study, we actually grade them, level 1 or, 2, 3, and 4. So the most important and the most effective sleep study is the one where they come into a lab and we measure a lot of sleep parameters, which include an EEG to look at the stages of sleep, an EKG to see how the heart is doing, leads on snoring, chest expansion, abdominal expansion, and muscle movements and oxygenation. That's the most validated sleep study. Okay. That's the most important sleep study, and unfortunately, it's a bit expensive and involving. So they've come up with what they call home sleep apnea test. The simplest one is level 4, which is just oximetry. So a lot of people go home with just an oximeter and see if the oxygen drops. If it drops, there might be something going on. We don't know what drops it, though. So the level 3, which is most of the home sleep studies, have a few more parameters. They look at the cardioballistics, and there are some others which look at the snoring and a band across your chest. And you go home with the equipment, you put it on. You're taught how to put on an oximeter, maybe something on the throat to look at your snoring and breathing, and another thing to look at your heart and pulse. And those are the home sleep apnea tests. The ones we use here at South Georgia Medical Center is a watch, which looks at your heart rate, your pulse, and an oximeter. And another one which goes to the throat, which tells us how your breathing or snoring is. And that will tell us what's going on. It's an easy, disposable thing. It's very easy to use. You take it home. There's an instructional video on an app. You just download the equipment information onto your app. You switch on the device. That's all you do. You sleep with it. The next day, you can keep it as a souvenir or dispose of it. And the data comes to us through the cloud, and we read it. That's a sleep
Everything's
study.
gotten so much easier.
Yeah.
It's a great option, for patients that are like, I don't want to sleep in the lab, or I don't think I'll be able to sleep in the lab.
Right.
How do we test for this? So the watch, Pat, will help us, really look if sleep apnea or something's the cause. But if it's more complex and we need to look at the sleep stages or the leg movements, the in-lab will show that more detailed and those complex sleep disorders.
Yeah.
And that lab is very nice.
It is. It's like a nice hotel room, I call it.
It is like a nice hotel room. It's not like your typical hospital room.
Right.
So it is designed to be a little bit more comforting for you. So that's good. So what about, so if you do find something, what are the most common treatments for sleep? Like, is it the CPAPs? Is it the, what? I feel like a lot of people are nervous because they don't want to get put on one of those.
So I tell patients, for obstructive sleep apnea, of course, the first thing you think of is the CPAP, and people automatically think of the big mask over your face, and that is still the gold standard. If you do have obstructive sleep apnea, is a CPAP. But they make tons of different masks. They have kinds that just go in your nose or a little in your nose over your mouth. So there's a lot of different types that we can find comfortability with through these medical supply stores here in town. We're super excited now that we are offering Inspire therapy at SGMC Neurology. And actually our neurosurgeon here at SGMC is actually about to start placing Inspire as well. So we're about to start offering this service completely in Valdosta.
Yeah, this is a service for people who cannot tolerate the mask because the pressure's too much or their nose gets blocked or for various reasons. They're claustrophobic, they can't use it. So these are one of the alternative ways of treating sleep apnea.
So there's a lot of different types. Inspires for moderate to severe patients that can't tolerate the CPAP. Weight loss can help with sleep apnea severity. There's mouthpieces that can actually use that piece to move your jaw forward to keep your airway open. So
a lot more options
there's a lot more
than you
options
think,
that people would think of. Yes.
And maybe a couple of years down the road, there'll be some medications to help with the sleep apnea as well.
Talk about the Inspire a little bit. What does that do?
Yep, so Inspire is actually a little device. It looks like a little pacemaker they place right here in the upper right chest. And it's a little electrode that's over the tongue nerve. So, a CPAP uses air pressure to move the tongue out of the way, to keep the airway open. So Inspire, there's a little remote. So the machine essentially is inside of you. So you're the machine. So the remote at night, patients actually turn on that stimulator and they go to sleep. So there's nothing on their face. There's no machine that they're working with. And we actually set the parameters in the office where when they breathe at night, it's sending a gentle signal to their tongue nerve. They don't feel it. Patients are sleeping through it, but it actually moves that tongue out of the airway. So it's only on while they're asleep. They can pause it in the middle of the night. They have to get up and use the restroom or take a sip of water, and then they turn it off the next morning.
That's
so
fascinating.
It's a really
Yeah,
cool
that's
thing
wild.
to see. Yes.
Wow.
It reminds me of what Dr. Mackey was doing with the vagal nerve stimulators.
Yeah.
That kind
Yep,
of
it's the
similar
same
to
type
that,
of thing
but
except
just
for
a
a different nerve.
treatment.
Exactly.
Wow.
We've come a long
We
way.
have.
Yeah, yes.
All right, well, that's good on sleep. Let's move over to dementia because there's a lot of stuff that y'all are doing in that area, and I know that impacts so many different people now. It seems like everybody I know these days has a family member or relative who's
Yeah,
suffering
you know,
from something.
it's the demographics of the whole country. The baby boomers are getting older, and there are not enough younger people to replace them. But the demographics are sort of top heavy. So a lot of people are getting older and they're living longer, and more dementia is being diagnosed. The data from 2024 shows that about 80 to 84 million people now have dementia, which is diagnosed. But this is just the tip of the iceberg. There are a lot of people who have what you call mild cognitive impairment or early dementia, which has not as yet been diagnosed. And there's so much need and there's so much cost to the population because family members to look after their demented patient, parents and all that, often have to leave work to become full-time caregivers because there's not enough care going around that.
Yeah.
So the goal is to catch dementia early on and treat it because currently there is treatment for Alzheimer's dementia, not the other types of dementias. These are infusion therapies which will stop the progression. The current data shows that it may, in some cases, also improve the memory a little bit if it's caught in time. Now, we can use this treatment for early dementia, but not for moderate to advanced dementia, because then the damage is beyond repair and it may still progress due to other factors. And now we have this new infusion treatment, which Shelby tell you about.
So
Tell us about who would qualify for that, kind of how that works.
Yeah, so my first thing I like to say is it is for early dementia or when we're in that mild cognitive stage. So I always tell patients, if you have a family member or a loved one and you're starting to notice some memory issues, speak up because if we can catch this early, we can treat it early. So that's what these infusions are meant for. So like Dr. Eisa said, this is the first treatment that's FDA approved that's actually affecting the disease process. Up until now, we've been symptomatically treating dementia. So now we have a treatment that is actually affecting Alzheimer's and slowing down the process, which I think is very hopeful, for patients and family members. And we're offering those infusions now at SGMC Neurology. So, getting that word out that we can treat this early and so patients can go to primary and primary can be educated to start working up that, hey, this is an early memory issue, let's send them to neurology and get it seen about. But we are doing it now, which I think is amazing because up until now as well we've been sending patients to Shands or Mayo Clinic to get this treatment, but we have the access here now for our community and surrounding communities.
So this will be the main infusion treatment for the whole of South Georgia and possibly North Florida as well. Once, it's already started and people are already in the pipeline for treatment. But the key thing is diagnosing it early. Now, a lot of primary care doctors are a little bit afraid of, the diagnosis and what to do, and they don't know if they do the testing, what is the next step to do. So we're going to try to make it a bit better. We've tried to join the Georgia Memory Network, which is a statewide organization, which will reach out to primary care physicians and other things to make them aware and send patients to a center like this where they can get treatment. And there are easy diagnostic steps. Anybody can do what you call a mini mental status examination as a screening tool, simple questioning. And there are currently what you call blood-based diagnostic tests. It's a simple blood test which you can do, which can tell us if the patient has Alzheimer's dementia or not. They don't have to go through specialized testing in the past, which is a spinal tap and PET scans and different things. So the catchment population is out there. The treatment is easy. It is FDA covered, and we should be able to get a lot of people treated this way.
Is it hereditary?
There is a small component which has a gene like the ApoE4 gene. If you have two alleles, that means two copies of the same gene, your risk is higher. It doesn't mean that if you have it, you're going to get Alzheimer's dementia.
So it's not a diagnosis, but it's a risk factor.
Yeah,
Something
so
you
it's a
should
risk
just be
factor.
aware
Yes.
of.
And those, so there is a genetic factor to this. Yeah.
And that's something we test for when we are working up our dementia patients. We're looking at that risk and seeing if that gene is there.
Well, I know there's probably a lot of stigma that goes around just like with any kind of mental health issue. Like it's just raising awareness that like you need to voice these things if you notice them happening within yourself or your family members.
Yes,
To what you said, feel more comfortable talking about it early, especially if now there's options that could be out there versus kind of suffering in silence.
Right.
Well, I had no idea it was just a blood test that can help you identify that.
Yeah, a lot of people still don't know that,
Yeah.
and we need to make the public aware of this.
Right.
And it's just so easy to test for now. You know, if I'm even concerned with it and we're landing in that area, those memory testing that we do, that they could be a candidate for these infusions, I offer, hey, let's go ahead and see if this is something we're dealing with so we can treat it if it's there. So it's too easy not to check for it now.
Right.
Yeah.
Absolutely.
Now, to put things into perspective, there's such a shortage of medical doctors and all that. And getting into neurology has a wait list of 6 months and all. So we at South Georgia Medical Center are now training nurse practitioners to take up a lot of the load and get people in quicker, for example, within the next couple of weeks for sleep disorders. So we have Jennifer, our nurse practitioner, and we have, for dementia and all that, we have Shelby, and we'll probably get some more and make things so much easier for primary care physicians and for the public to get into, to be seen for these disorders now.
Yeah, I think that's absolutely great. I mean, as a health system, we're definitely having to evolve in that space
Yes,
because,
yeah.
I mean, it is an issue just nationally, enough physicians and enough nurse practitioners in general. So I think patients shouldn't, feel like they're getting any less care. Know that it's a team approach and y'all are in this together. So, but just getting the patient in quicker and being able to do that diagnosis is the goal.
Just the
and getting
sooner
them
the better.
treatment.
Yes.
Yeah.
Very good.
Other than sleep and dementia, what would you say is one of the other top things that you see and treat?
Numbers wise, headaches is one of the
Migraines,
biggest
yes,
ones.
yes.
Migraines.
Migraines
Yeah.
are very prevalent.
Yeah.
For sure.
So that's another very, very common problem, migraine headache specifically. Difficult to treat, but there are good treatments out there now. The different types of headaches. Following that are nerve problems from diabetes, and injuries to the spine and all that. And then there are other things like epilepsy is not uncommon. Yeah, it's also a very common problem. So these are some of the more common things we see. There are a lot of uncommon things as well we see, but these are I think, the top most neurological problems that we address.
Tell us a little bit about medical education, because that's kind of, we've evolved as a health system, got many more students, many more physicians here getting trained. How do you feel about that, and kind of what's your take on it?
Well, we've been training medical students and taking in people from high schools and schools and having them shadow us, especially at the neurology clinics. Like I've been a professor with the Medical College of Georgia since 2009. And I was a professor at Yale up to 2006 before I moved here. So we've always been training students and all that, and we encourage them to come into the medical field. Now, I don't know if you know it or not, but the Medical College of Georgia has a sort of a shortcut for people in the local area through the Albany campus. We call it the Southwest campus. The neurology clerkship director there as well, to get our students from the local areas into the stream so they can get into medical school. Now, Mercer University has also started the stream, and they are going to open up a medical school here as well down the road. It will probably get bigger. So we have 2 medical schools which, have their presence in South Georgia Medical Center. And if you can get more people into the field of medicine or into nursing or whichever medical field it is, the better it is, because there's such a shortage. So we encourage people to come inquire about this and get into the medical field. Yeah.
We need you. We need you.
We have our volunteering program for the high school students over the summer. We've got, college volunteers, the shadowing. I mean, there's so many opportunities for anybody who's maybe interested in medicine and you kind of want to get that inside look.
Yeah, I just had a college volunteer program attending with me for probably, 4 months, and she was great. But I feel like, and she told me, I kind of helped show her this world, and she's going into nursing now, so kind of given that experience to see what we do and the complexity and
Yeah.
the people we get to help.
So we are collaborating with the Valdosta State University nursing program. We're trying to get the nurses from there to join us for specific training for neurology, and I'm sure in other specialty fields as well. We will be starting up a sleep technician training program at our sleep facility through the American Academy of Sleep Medicine. It's accredited, and it's called the A-STEP. So we'll be starting that soon and getting students come in to be trained as sleep technicians.
Yeah, there's so many healthcare related careers that are in high demand that you just don't even realize, such as a sleep technician or so there's so many opportunities for people that would consider a medical career but maybe don't want to go be a full-fledged doctor. They're not that committed, but they still want to help people in some way. So it's good to be aware of these different avenues because they could be, very impactful for someone.
Absolutely. Well, I think that's all of our questions, but we do have one more that we ask all of our guests, and that is, what is your favorite meal to eat here at SGMC Health in the cafeteria or the Allspice?
Well, I'm not eating at Allspice.
We're at the outpatient clinic.
Yeah, no, they're at Smith campus,
So I can't make a comment on that, but I can
That's
tell you
okay.
at the Smith Northview.
Northview
Yeah.
does a great job.
They have various things up there.
Their pork chops, Smith Northview's pork chops are great.
All right, I hadn't heard that one, so that one's good.
All right.
We always like to give them a shout out because they keep us all fed and running.
Oh, yeah.
That's right.
Yeah.
So,
We're very thankful for them.
yeah, because we don't really have a lot of time to eat usually, All right. Well, I just want to say thank y'all for coming on today. It was
you for
very
having us.
informative.
Yeah, thank you for having us.
Is there anything else you want to share that we might have missed on before we wrap it up?
Not really. I mean, if you can get the word out to the public, that's great.
Yeah,
I say if you're having
absolutely.
any issues, headaches, sleep issues, obviously the more complex seizures, Parkinson's, MS, multiple sclerosis or MG, myasthenia gravis, we're here. We're in Valdosta. We love helping our patients. I love being accessible to our patients. So just getting the word out that we're here, and we're offering these new treatments and new things that we're just really excited about because, we're kind of a small system if you compare us to what we've been sending to these tertiary care centers or teaching hospitals, but we're doing that here now. So we're kind of moving up and really excited about it.
Well, congratulations on that note to your teams for taking on these new advanced treatments and getting those implemented and doing the work behind the scenes that it takes to make that happen, because I know it's not something that just happens overnight, but truly does impact our patients here in our community. So we appreciate that.
Absolutely. Thank y'all.
All right. Well, thank you for tuning in. We will, of course, put links and contact information so they can get in touch with you. And then, of course, if you haven't already, you can always like and subscribe so that you can stay abreast of all of our new episodes. And we just thank y'all for tuning in.